This hospital has taken a special precaution measure against the novel coronavirus. All outpatients are required to check their temperatures at the entrance. Outpatients who are suspected of having the coronavirus come to this designated clinic. Toranamo Hospital divides those who are suspected to have the virus and those who do not. The medical institution has come a long way since the first outbreak. The first COVID-19 epidemic unfolded in Japan from April to May. Officials and healthcare workers had to brace for a spike in infections. This footage shows a completely different hospital in April. New patients continue to be brought in through the doors. When other hospitals turn to them for help,
今日はですね、重症も満床で申し訳ないんですけど、もう入れないんですよね。すみません。はい。
many hospitals were forced to refuse patients due to the lack of beds. During the first outbreak, Toranamo Hospital decided to increase the number of beds for an expected influx of patients. But simply increasing bed capacity failed to fix the problem. These are the results of coronavirus tests conducted at the hospital. As of mid-April, 13 out of the 17 hospital beds were occupied. By the beginning of May, only one bed was available. The hospital held a meeting on July 2nd to assess the first outbreak. They realized the severe shortage of beds at the time. Managers are planning to increase the number of hospital beds further before the second wave of infections come, but they fear that will not be enough.
高齢者の方や、あるいは基礎疾患のある方に、感染が広がってきたときに、やっぱり重症者というのが急増して、医療体制が急にやっぱり逼迫するっていう困難な状況が、陥るということが、十分あり得るのではないかと。
A woman in her 70s who was hospitalized in early May is a good example. Her ventilator was recently removed, but she is still in no condition to be discharged. The longer the critically ill patients are hospitalized, the higher the risk to the healthcare system. On June 30th, the Tokyo Metropolitan Government asked medical facilities to triple their bed capacity to 3,000. Officials also raised the alert in Tokyo to the highest level on July 15th. Governor Koike Yuriko reiterated that it is crucial to secure beds to protect the healthcare system. But increasing the number of beds alone will not be sufficient. Securing labor is another challenge. Toranamo Hospital has only 4 doctors in the infectious disease department. Medical staff from various fields were asked to help during the first wave, including those from the ICU and respiratory department. This hospital plans to follow suit in the event of a second wave. They also implemented more stringent infection prevention training to protect health workers from the virus. Medical professionals removed their personal protective equipment at this point when they returned from the red zone. Infection risk is set to peak when they remove their PPE. Their instruction video shows how to remove goggles and protective gear. The video also warns to thoroughly disinfect and sanitize their hands. Mental health conditions of healthcare workers is another important issue. Counselors say that 30% of the medical team is in a constant state of stress, not knowing when the epidemic will end.
やっぱり違う今度はストレスになったりっていうことが生じてきますので、このCOVID の対応が続く限り、やはりその枠組みも持っておきたいなと思っておりますし。
Securing hospital beds and labor and ensuring healthcare workers' safety will be essential to overcome the epidemic.
患者さんをやっぱり継続して安全に受け入れるっていうことは、これはもう当然のこととして、やはりその対応にあたる医療従事者の方の安全を守るっていうのも、やっぱり重要なそういうテーマかなというふうに思っています。